Several months ago, a comprehensive study conducted in the United States showed that nearly 2 million cases of cardiovascular disease could be prevented and $40 billion could be saved in healthcare costs with a readily available medicine that you can purchase at any grocery store. Cardiovascular disease is the #1 cause of death in the US. On average, we spend almost double the amount of money on healthcare than other first world countries. So this news should have been groundbreaking. Unfortunately, this medicine doesn't come in a bottle, and large corporations won't be able to make a huge profit off of it. So you might not be seeing any commercials about it anytime soon. What is this miracle drug? You can find it in the produce aisle. In the last 10 years, I've been called a veggie pusher on more than one occasion. My nephew once said that he feared coming back to my house because he was constantly being exposed to foods that are actual plants picked directly from the ground and not typically found in my sister's home. My obsession with vegetables started 10 years ago at the exact same time that Michelle Obama broke ground on her White House kitchen garden. There's a very real possibility that I am standing up here because of her example, but I like to think of my journey toward this topic as one that follows my grandparents' and children's lives. Even after I stopped nourishing my babies with breast milk, I felt a sense of obligation to ensure that they continued to be fed with the goal of their long-term health always in the forefront of my mind. I made homemade baby food purees, and then when they began to eat more solid foods, I studied up on how to hide veggies in regular foods to ensure that they would be getting the nutrients they needed even after the picky years set in. This led me to start a community garden in my neighborhood to grow my own fresh veggies, and I volunteered at my local extension office to offer my talents to their new 4-H programs, which were designed to help kids eat healthier. Now, 10 years later, I'm working at the same 4-H office, running my own program that teaches youth about the value of healthy eating. In addition, I'm about to finish my master's degree in public health promotion. In the last 2 years of my graduate program, I have come across numerous research articles that highlight the need to create a significant shift in our healthcare system toward prevention medicine. And that is what I really want to talk to you about today. I tend to follow a philosophy given by the well-known food author Michael Pollan. And we should think about food as simply as possible. Don't eat anything your great-great-grandmother wouldn't recognize as food. I have seen the light bulb turn on many kids' minds when I have said this, quote, it always has such an impact on them. It's just so simple when we think about what we should and should not be eating. Did my great-great-grandmother eat corn? Yes, okay, it's probably good for me. Did my great-grandfather eat eggs? Yep, I can have those too. Did they obsess over spicy Cheetos when they were teenagers? No. So I guess I should probably avoid them. But Grandma's homemade oatmeal raisin cookies would be fine. There are definitely many conflicting messages when it comes to what we should be eating for optimal health, and much of it is driven by corporate interests or greedy business people disguised as wellness gurus. The fact of the matter is that wellness does not need to be complicated, and it does not need to be expensive. And although it is not, it should be available to everyone in this country. The recent study I alluded to earlier was conducted by researchers at Tufts and Harvard universities, and it looked at the effect of 2 interventions and then compared them to no intervention. The first was a 30% subsidy of only fruits and vegetables. And the second was a 30% subsidy for fruits, vegetables, whole grains, nuts, seeds, seafoods, and plant oils. This second intervention was termed the Healthy Food Incentive because these foods are now widely known to provide the best total nourishment for optimal health. The results of this groundbreaking research were staggering. The fruit and vegetable incentive saves nearly 2 million cases of cardiovascular disease and $40 billion in healthcare costs. The healthy food incentive would save 3.3 million cases of cardiovascular disease and a whopping $100 billion in healthcare costs. That's equivalent to 13% of the total amount currently being spent on Medicare and Medicaid patients for healthcare. And that savings could be seen in as soon as 5 years after implementing the incentives. This graph from the American Heart Association shows that we spend over $300 billion on healthcare costs on cardiovascular disease alone. But there's also research that clearly shows that diabetes, particularly type 2 diabetes, can be prevented with a healthy diet. And the same recommended diet also has benefits related to the development of Alzheimer's disease. So all 3 chronic diseases could be improved through the food incentive programs. This information clearly demonstrates the need for a shift from the medical care system we currently have, where solutions are found in bottles, to those that are grown on the vine, in the trees, underground, and in the ocean. We now know that this paradigm shift from medical care to true health care is necessary, and it will take all of us pushing for this shift to make it happen. In order for this to take place, I believe we can start in 3 areas of reform. The first is by incorporating integrative medicine approaches into Western medical training. My niece just graduated from a prestigious medical school with all of 2 hours of nutrition education under her belt. With that lack of training, kids and parents are not learning the importance of dietary changes from the person they trust the most with their healthcare needs, their family doctor. Public health professionals should be working with the medical community to instill the value of simple nutrition education concepts that can easily be delivered to patients during their 20-minute appointment. If food is the answer to our most pressing healthcare problems, we must be training the professionals who give the most advice. Number 2, the federal government holds the key to growing prevention programs through diverting Medicare and Medicaid funds to ideas like the produce prescription program. The research shows that a much larger proportion of people who suffer from preventable chronic disease are low-income and minority people. Produce prescription programs use grant dollars provided by the U.S. Department of Agriculture to reduce the cost of fruits and vegetables purchased at local grocers and farmers market for low-income people who are at risk of developing chronic diseases. The researchers clearly state that nearly half of all cardiometabolic deaths are linked to a poor diet, and that incorporating incentives for healthier eating could improve the health of Medicare and Medicaid patients and save large sums of money, of government money, in a relatively short period of time. I believe that programs like these could be the much-needed launching pad for greater access to nutritious food and the medicine that is so desperately needed in these communities. Number 3, we need to be willing to play the long game on this. Changing the face of medicine, food distribution practices, and millions of people's eating habits will take time. This can only be accomplished with a concerted effort to ensure that the next generation of soon-to-be adults will build on these ideas in order to make real change in our healthcare outcomes in the long term. This can be accomplished by teaching kids about the connection between the diseases they are seeing their family members suffering from and the foods being eaten at home and in school. They need to see their role models leading by example. They need to be taught how to prepare simple, delicious, low-cost food and learn that the unfamiliar sensation of a plant leaf in their mouths is something worth getting used to. They need to be involved in the decisions that are made about the school lunch programs and their family meals. This is all part of a long game that will likely be resisted because it will affect the bottom line of those who have made a profit of making our population overweight and undernourished. But it will be worth it. It only took a couple of generations to forget what was good for us, and it may take us that long to remember. It must be all hands on deck to build on these innovative ideas that need to be promoted and fostered. We're going to need medical professionals to stand up against the pharmaceutical companies who push the medications on them as the only solution to our society's health problems. In order to achieve the best health outcomes, all of the available health science needs to be considered, including prescribing the solutions found in the grocery store produce aisle. The federal government can make these prescriptions affordable by providing incentives for people to purchase healthier foods. And in order to guarantee success, the younger generation will need to adopt these ideas and accelerate the change, but it will be up to us to convince them that healthy food is the best medicine. Thank you.